Throughout our conversation, cataracts have come up a couple times. Talk about what those are and what can be done to prevent or reverse them.
Good question, because cataracts are really common, right? Cataracts, to understand it, inside of the eye, there's a lens. And this lens you're born with, it's clear, it's flexible when you're a kid, it's really thin when you're young. And as you get older, this lens actually thickens. It actually grows one extra layer thick basically every year of your life. It's kind of like looking at the rings on a tree. If you ever look up images of it, you can see individual rings in the lens. As the lens gets thicker throughout life, starting in your like mid years of like 45 to 55, this lens gets so thick that it becomes difficult to flex. It's no longer easily flexible. And so when you're a kid, you can focus from far away and then you can look at the tip of your nose almost because this lens inside is so flexible. You can adjust it in so many ways. But then once you're in your 45, 50 years, it's really tough to flex that lens anymore because it's so thick and rigid. And so we call that having presbyopia. But that's why people need reading glasses and bifocals in their midlife. As you continue to age, though, and you start getting into your 60s, 70s, and above, the same lens starts to oxidize. It starts to become cloudy and can turn kind of a white or a yellowish color. And it kind of it's like looking at a marble almost. But because it clouds over, you can't see out of it. The world around you gradually becomes more fuzzy. The quality of your vision decreases. So your ability to detect contrast, difference between whites and darks, becomes harder. Kind of the classic example is I'll have an old man come in and I could probably guess that he has cataracts because not only his age, but I look at his socks and he'll have one black sock on and one dark blue sock on. He probably can't tell the difference because there's just too clouding of a lens. And so worldwide, cataracts is one of the leading causes of blindness, especially in underdeveloped countries where they don't have access to cataract surgery. But thankfully, in a lot of developed countries like here in the United States, cataract surgery is one of the most successful surgeries available. It's incredibly fast and efficient and accurate. Basically, it takes longer for them to get you ready for the cataract surgery than it is to perform the procedure. But what they do is they shatter the lens inside the eye using ultrasound. And then they suck it up with a small vacuum. And then in its place, they take a plastic lens that we can determine what power of lens needs to be inserted inside the eye based on your need for glasses. And then they can put that new power inside of the lens that they implant. And then fingers crossed, you may not need to rely on prescription glasses afterward. It depends a little bit on everybody's individual needs in their eye, but also what type of technology may work the best for them. Because we also have different lens designs for the implants, including multifocal implants and a couple others. So pretty cool.
On a preventative layer, though, anything people can do, or it's just part of aging?
So there are, again, there are studies that have looked into this. We do know that sunlight exposure is weakly associated with cataract development. There are different forms of cataracts. There is one called a cortical cataract that does have a higher association with UV light exposure. So we do recommend still UV light protection, protecting the eyes. We know that antioxidants in the diet are really good. Again, vitamin C, very potent, and you want to make sure that you're not deficient in things like vitamin C, right? No scurvy. We know that people who smoke, people who drink more often, they also have a higher risk factor for developing cataracts. People who take steroids, whether it be topical eye drop steroids or oral steroids for long periods of time, they are also at higher risk of developing cataracts. Those are probably the biggest ones. Otherwise, it's kind of like getting gray hair. Eventually, everybody will slowly start to develop a cataract if you live long enough. But that being said, I have had maybe 2 or 3 patients in my career who were like over 100 years old. They still had cataracts inside their eye. They haven't had cataract surgery. and they still saw relatively well. They were able to see like 20/25, right? Assuming everything else was still functioning with their brain normally, they were still cognitively there, they would still pass a driver's test for the visual requirements for a driver's test. Not everybody will require cataract surgery, but the vast majority of people will probably benefit from cataract surgery at some point in their life.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
Diabetes affects the eyes significantly. Not only does diabetes increase the risk for things like cataracts, diabetes affects the blood vessels throughout your body, and the retina in the back of the eye is one of the most highly vascular organs in your body.